Imagine a world where accurate and early diagnosis would help a cancer patient get appropriate treatment towards faster recovery. What would that world look like?
Well, there have been 4 countries involved. The African and Indian countries are very different in terms of everything from research approach to just history and experience. And the UK researchers are learning all the time, and about ourselves as well as about other people. I think we've been cultivating, efforts by health researchers to try to understand industrial data, by industrial researchers who are interested in health, to have found health colleagues who actually want to talk to them for the first time. I very much hope that what will come out of it is a body of writing and a set of inputs to policy and policy debate, which both influence how cancer care is thought about. I really hope that, and addressed in low and middle income contexts, but also really does pull together. It's one of a series of processes that are pulling industrial researchers and health researchers closer together.
The ICCA India research team, headed by Professor Smita Srinivas, is exploring the intersection of economics, health, and policy analysis in cancer care.
The Innovation for Cancer Care in Africa, or the ICCA Project India team, is based at the National Centre for Biological Sciences of the Tata Institute of Fundamental Research in Bengaluru, India. Our ICCA India project analyzes innovations in cancer care by studying firms and industry changes, and we really want to know what kinds of institutional design would reduce the risk and make low-cost, early and effective interventions in cancer care actually possible. Unlike other studies, we focus on the industrial background to innovation in cancer care rather than the clinical end. We study policy measures that influence the technological learning of firms and the innovations needed, whether they be technical, organizational, or institutional, in affecting cancer prevention to treatment and rehabilitation to cure. An economics and policy focus on firms and their industry dynamics allows us to see which cancer problems might be better addressed. 2 examples that we are studying include cervical cancer and palliative care morphine. Please meet our ICCA India team members.
India is a potentially critical player in the global scientific, technology development, engineering, and industry dynamics of cancer care. But despite its history of solving far more complex issues, and with all of its industrial capabilities and its status as a supplier to the world, interestingly, India has not been able to tackle the problem of access to cervical cancer care. The project has been really enlightening, as a lot of my research allowed me to see just how fragmented the system was, with strong individual moving parts that didn't quite fit together as they should.
The ICCA project gave me a chance to look at palliative care and the availability of medical morphine in India. By looking at the production, procurement, and consumption of medical morphine, my research contributes to understanding the major issues and the kind of policy interventions required to improve access to medical morphine in India.
I have learned that the issues of supply chain of raw materials or drugs are not only caused by logistical issues but also have significant policy issues. The process of research was enjoyable because it allowed me to see the confluence of different research methods like observational, derived, etc. The one issue that I was surprised to know about India was that we had restricted the usage of cheaper drugs for palliative care.
India has recently moved to a population-based screening system, where the role of firms is extremely critical in driving better screening outcomes. Through my research, I realized that India had very few domestic manufacturers of critical equipment, even like digital mammography machines. In our research, we found that the problem is not one of science and technology capacity, but of better economic policy that can incentivize firms to innovate.
Come, Join us on our journey as we discuss what it means to study cancer care from our perspective. Be sure to watch the next video and other materials from the ICCA India project.